The National Health Mission, through the Office of the State Tuberculosis Officer, Government of Meghalaya, had organized a one-day state-level media workshop on National Tuberculosis Elimination Program in the state. Those present during the event included the Director, National Health Mission Meghalaya, Ramkumar S, the State Tuberculosis Officer, Dr. M Mawrie, the Assistant Program Officer, State TB Cell, Dr. A J Rynjah, DRTB Coordinator, State TB Cell, Dr. Duke Lyngdoh, the State PPM Coordinator, Jovialroy Diengdoh, members of the Shillong Press Club, besides others. The workshop aims at sensitizing the general masses through media support on the complete elimination of tuberculosis from the state by the year 2025. The state vision for a tuberculosis-free state determines to decrease the TB burden in terms of incidence rate down to 44 per lakh, the mortality rate down to 3 per lakh, and reducing catastrophic cost due to the disease to zero by the year 2025. A pledge for a TB-free Meghalaya was also taken by all present, while urban TB survivors had also given their testimony during the program.
Tuberculosis is a chronic infectious disease caused by a bacteria called Mycobacterium tuberculosis, which was identified by Robert Koch in 1882. So we are thankful to this scientist, Robert Koch, for this great job that he has done. We have achieved 4,189. In 2022, till March, we have achieved 1,075. And the treatment success rate, the target was 90%, we have achieved 81, and the 22, we have achieved 21 also. But the death rate is 6%.
How did we handle COVID? Was more or less, where did we get the learnings, systemic learnings to handle COVID? The COVID handling actually, once we started it, more and more realized it was nothing more than like a TB only. Because the process was the same. You have to screen people for symptoms. If they have symptoms, you test them only. If they have symptoms, then you isolate them. You have to start from a prophylactic treatment to other people who are there. And you should not let them, with symptoms, you should not mingle too many because it is contagious, it can spread to other people. High risk contacts, low risk contacts, contact tracing, all these things have been in TB. And TB has a very old disease known to us. And TB program is even older than National Health Mission itself. And we have had one of the more amazing hospitals in the entire east of India is in Shillong for tuberculosis treatment. We had this kind of thing, but unfortunately, the attention which we gave for COVID, we are not able to give the continued media attention or all the attention required for TB patients, unfortunately. Now, why is that? COVID, irrespective of whether you came from much rich background or very very affluent background or from a very well-connected background, it kind of reached out to everyone. So COVID was a very egalitarian disease. Unfortunately, TB is more or less looked like a poor man's disease. That's why it does not get the attention. But the number of deaths, if you see how much TB deaths has happened during the period in India from different states in Meghalaya, or in Meghalaya, it is nothing less than 2 years, we have had close to 1,500 COVID deaths.